Thanks, Amy. Hi, everyone. Welcome. I'm one of the executive directors of Nourish, and we're just so thrilled to be joining all of you today to be learning and getting inspired by this exciting work that's being led by Vancouver Coastal Health, a first in Turtle Island. So we wanted to start off today with a territorial acknowledgement before we dive into the lessons learned. And I think this is an integral part of this work. So we're all joining across Turtle Island and invite you, as some of you have already, to share your personal acknowledgement of which territory you live on. And I chose this picture here as I've just returned back to the land of the Micmac in Eastern Canada. And I chose this picture of a Makwe-Kawatka. I was practicing the pronunciation. I hope I did an okay job. The red spruce, which is used by Micmac people for medicine, crafts, and fiber on this territory that I'm very grateful to currently live on. And it's so vital to ground our conversation today, I think, in this connection to the land and the relationships, the culture, the ecology that are all so powerfully brought together through food and the ways that we gather at tables and how we support healing in healthcare. And it's what we need to do to ensure a sustainable food future for people and planet. So next slide, Nari. So just to ground us a little bit in today into this bigger picture of planet, as 1/3 of all the greenhouse gases are linked to food, it needs to be part of the climate equation. So I just wanted to bring this in on the left, a visual of where we stand currently. Our current footprint of our food system is the yellow bar on the left, and the yellow bar on the right is where we need to go. So it's a pretty stark visual showing all the different food system solutions, the little bar charts in between there. And those are strategies around sustainable seafood, increasing farming productivity, transitioning farmland that should be forested or should remain in wetlands back to those ecological services. And over on the left, you see the large red bar, which is the impact of shifting to sustainable diets. And it just shows how significant this solution is in the mix. So if you click, Nairi, my amazing animation is going to show up there. So next slide. So shifting from our current high meat diets that are sourced from industrial farms towards plants is just crucial. And we're really thrilled that the Lancet Countdown, their second annual climate report for Canada, really just brings this to the forefront of our minds of how we can take action on climate, and we can be doing it 3 times a day. So this was supported by the Canadian Medical Association, Canadian Nurses Association, Canadian Public Health Association. So we've got our big thinkers and drivers around how we build health and build climate, take climate action at the same time. So we're just so, with Nourish's work is really grounded in this tremendous opportunity for health systems purchasing power to drive this shift, and plant-rich diets that can help to create more food security and local sustainable food economies across the country. And we need to ensure that we're doing this without our carbon tunnel vision and keeping cultural mindfulness as a central tenet of how we do this work. So turning to one of these strategies, what we're gathered here today to learn and hear all the ins and outs of how the amazing team came together and brought to life the first pilot at the hospital scale of a plant-forward menu. And this is just where we see the power of healthcare, where we're nourishing patients, helping their healing, and we're also showing the power of the healthcare sector's leadership. And I think it gives us a sense of hope, and also it's tangible, and we're just really excited to hear more about that, what came behind that to inspire everyone else to follow these early leaders that we have. So I'm going to pass it now on over to Haley for our fireside chat.
Thanks, Jen, and welcome again, everybody. I'm Haley Lapalm, co-executive director with Jen, and I'm joining today from southern Vancouver Island, from the unceded traditional territories of the Cousapsum and from the Songhees, and it's actually the traditional territory of the Songhees where my own little neighborhood is situated. And so expressing my gratitude for the abundance that we all live and work with, and wanting to bring that frame into our conversation today, with thanks to the elders and knowledge keepers that have shaped so much of Nourish's work over the years, both here and across Turtle Island. So let's get right into it, because we have got an incredible action-packed lineup of players who have all contributed to the success of this really sector-leading work at Vancouver Coastal Health, at Vancouver General Hospital. And so I'm going to bring on our first guest today, Dr. Annie Lalande. You're going to see a whole host of characters today, and we'll do our best to extract the best nuggets from, actually extract's maybe not the right word, to hear the kind of the key anecdotes from all of these players who contributed to the work. So Annie, like I said, we're going to start and we're going to end with you today. And so you've got quite a story that you helped to get rolling. So why don't you just start by telling us, how did this all get started?
I mean, serendipities come up a lot as a key way that we've gotten into this work. It's really come from the meeting of a lot of people who saw food as a lever and who were working on food in their respective fields, and were hitting walls along the way and continue to hit barriers. Um, from our perspective, we approached our food services team a few years ago, having some questions about how we could improve the sustainability of what we were doing in the hospital. And we were met with a lot of enthusiasm and a lot of curiosity about what we could do, but also some questions about, like, how do we actually practically do this? Um, and we were very lucky to get connected to your team at Nourish, and become one of the anchor cohorts. So from 2021 to 2023, we started our work with you. And rather than diving deeply into solutions, you held us back and asked us to get together, understand our problem, understand our stakeholders' perspectives and priorities and assumptions, which was really hard at first for our team. And when we leaned into it, it really opened up a lot of doors for us. And that was really kind of our entry point. And food in hospitals and the menus for patients is something that we've been interested in for a while. But it took us a little time to get there, to really build the network that we needed to be able to start making these changes.
So some of that going slow initially to go far from that.
Very much
Yeah,
so.
difficult, but like amazing application of that designerly mindset to and enter the work thoughtfully. So, um, tell me how your research project became a hospital-wide pilot.
So when we initially approached our hospital food services team, we had with our questions said, okay, well, that's great. Can we start by understanding what we're doing, what's working, where are some of the challenges, where are some of the environmental impacts coming from? So we did that. Started by understanding what was happening at VGH. And one of the main things that we found in terms of the menu and its environmental impact was that, unsurprisingly, given the literature that exists, most of it came from the protein portion of the entrees. So we came back to the team and said, okay, well, with all the work that we've done and with everything that we're able to do, we'd love to design an intervention, design a planetary health menu that's better aligned with the planetary health diet. We brought Ned on, started to have some conversations, and eventually, when we got to the nitty-gritty of it, our plan to have a trial for 100 patients over a number of months and with a different chef, and it was getting all very complicated. And in a leap of faith and trust, and with, I think, a lot of the work that, like, with a lot of evidence of the relationships that had been built and the shared commitment, our food services team said, well, look, we can't do this for 100 patients. Why don't we do this for everyone across the hospital? And we'll monitor and we'll, make sure that we're evaluating, but does that work for your research? Absolutely.
Incredible. Yeah. And so that process of getting the whole hospital involved, can you take us into that a little bit? What were some of the barriers? What were some of the heck yeah moments that got things moving?
So there's a few things that happened while we were doing our work with Nourish. Um, For one, food services used to be contracted out in British Columbia, and as a result of a bill that was passed a few years ago, all of them were repatriated and became the purview of hospitals again. So that really shifted the amount of ownership and like change that we could affect within the team. And the food services team also got reshaped a bit to enable the transformation that would need to happen with repatriation, with a lot of changes, but that also opened the door for us to leverage that degree of interest and transformation. The other thing, and you'll hear from our visionary leaders very soon, Planetary Health was positioned as a foundational pillar for our organization. And that also meant a lot of opportunities and a lot of support for this kind of work, and a lot of realization at leadership level that food, planetary health, all this really mattered to the care of our patients, both now, but to our communities at large as well.
So talk to us maybe a little bit more about that, Annie. As a physician, how do you feel, or how do you see plant forward menus supporting patient healing?
In a few ways. So in a few important ways. For one thing, while there are nuances in terms of the evidence around like, the most healthiest and sustainable diets, really what everything is pointing to has been boiled down really beautifully by Michael Pollan. Eat food, not too much, mostly plants. And I think that's where like we need to move as a society with what we're seeing in our national dietary guidelines. That's what we're seeing in terms of evidence. So from an individual perspective, from a like long-term health, there's a lot of benefits to moving to more plant-rich diets. In the hospital, we have an opportunity to influence what our patients eat, but also what they might eat when they go home. And there's not a lot of evidence around it, but there is some, and there's also a lot of experience from people knowing that when our patients leave the hospital, they do look to the hospital as a source of what should be healthy. And some of them will model what they eat after they leave the hospital on what we've been serving them. So it is important from like a societal message that our tray represents where the latest evidence around like healthy and sustainable diets are in a way that's adjusted to meeting our patients' needs so our patients are nourished. So I think we have the opportunity to start shifting social norms a little bit around like how people eat, because that's a huge barrier to adoption of more plant-rich diets. There's this pressure to conform, and meat has been positioned as something that we eat a lot. So it doesn't mean taking meat completely off the menu necessarily, but it means increasing the amount of plant-rich foods that we need to incorporate in our diet. So that's the individual health perspective. And then from a planetary health perspective, Jen has showed it very well, like the impacts of plant-rich foods in terms of decreasing our environmental impacts. We can't meet our Paris Target agreements without looking at how we produce food and what kind of food we produce either. So that's critical for our health and the health of the ecosystems that we really depend on.
You're a physician, a surgical oncologist. You're talking about
Resident.
Yes.
Resident, yeah.
How many of your peers are thinking about this, or
a little bit more now, especially here because we've been hammering on the message. At a global or like national scale, not enough yet. There certainly are a number of physicians who have really started to see the impact of food, and there's people who've been in this space for many, many years and who've recognized it for a long time, and who've been doing a lot of patient education, getting informed, and doing advocacy at that level. As a community, we have a lot to learn, and it's learning like enough that we can speak to it, because we know that our patients do listen, and it makes a difference if we talk a little bit about food with our patients, and it changes how open they are to hearing advice from our dietitians. And I think it's also about respecting who the experts are within this field. And we need to have enough knowledge, but we're not the experts. We have dietitians who've studied this and whose life work and profession is food. So it's understanding how much, like understanding enough that we can make informed recommendations, knowing where to pass the baton to the professionals and the experts, and having a good collaborative working relationship between both of us.
Okay, thank you so much. So Annie, we're going to come back to you at the end of this webinar to hear a little bit of some of the results of this work. So don't go far, because we're going to just tease that for the very end. And I'm going to bring in now Darcia Pope, and VP Strategy, Innovation, and Planetary Health. Welcome, Darcia.
Thank you, Haley. It's so nice to be here.
Yeah, okay, so what a powerhouse team is emerging here. So why don't you start us off, Darcia, by talking about why Planetary Health is important to Vancouver Coastal Health?
Sure. Thank you for that question. I think it's such a focus for us at Vancouver Coastal Health. And as Annie mentioned, we have Planetary Health identified as one of our pillars in the organization that is fundamental to all of the work that we do and the decisions that we make. And so Indigenous cultural safety, equity, diversity, and inclusion, anti-racism, and planetary health are our 4 pillars, and we recognize the intersectional approach that we need to take in thinking about really how we care for our populations, as well as our staff and medical staff through these lenses. So that really started to broaden the way we think about planetary health and that interconnectivity between human health and the health of the planet, and how it really is needing to be a part of all of our decisions. Just in the past couple of years, as we started to roll out our strategy, planetary health is also core to our strategy and rollout. And we've really enhanced the focus around the clinical sustainability component around that. So it's really anchored within our goal of exceptional care, really thinking about high quality, low carbon care and the changes we need to make and from a mitigation perspective, in addition to all the work that we're doing around adaptation and supporting our communities and their resilience. And so that, I think, really kind of broadened our focus in terms of where and how we advance work from a planetary health perspective. And it really started to create an environment where it was a part of our conversations at our senior executive team. It's part of our conversations at the board each and every time we meet around how are we thinking about the carbon impact of the work that we do and supporting our patient population at the same time as doing the best for our planet.
Great. So I've heard you describe this work as a triple or quadruple word score. So I guess a Scrabble fan. But can you talk to us a little bit more about where you got where the commitment and resourcing came to do this work?
Sure. I mean, I think, I'm just so lucky, like my portfolio having strategy, innovation, and planetary health together. Like, I just love talking about this particular initiative because it really is kind of that really triple word story. It's like fundamentally core to our strategy. And one of our strategic goals is research and innovation for impact. And really there we're looking at how do we accelerate and advance work that's core to our strategy, and how do we create partnerships and opportunities to resource new transformational work that might not necessarily all be available kind of within our base budget. So when our clinical team together with our food services team really wanted to advance this work, bring in an executive chef, you're going to hear more from Ned today, and think about how can we really advance this in a new and exciting way. We were really lucky to have innovative partnerships. Boehringer Ingelheim Canada is a core partner together with us who has a philanthropic arm. And we're lucky that they have this shared strategic priority around sustainability and around planetary health and a goal to drive innovation in healthcare in a sustainable way. Our Vancouver General Hospital and UBC Hospital Foundation also really supportive of us in trying to advance planetary health. So we were really lucky in a partnership with our VGH UBC Foundation, with Boehringer Ingelheim Canada, with Vancouver Coastal to be successful in getting an innovation funding to be able to advance this work. And now that we're implemented at Vancouver General Hospital and it has spread to other sites, we're in conversations with other foundations to really scale and spread this work much more broadly across our broader organization.
So as Dr. Lalande referred to, there was some requirement from Nourish at the very beginning of the work to go slow and actually to bring certain partners around the work. But you're talking about a whole other scale of it. Can you just talk to us a little bit more about that process of crowding those different, like bringing in the foundation, bringing in the other partners? Just take us a little bit into what that journey was like.
I think, it's really interesting because, part of it is us wanting to advance in innovation in the organization. And part of it is us wanting to elevate some of the new transformational areas that we're really most committed to, planetary health being one of them. I think where it really helps is just to be really clear on your strategy and your areas of focus and the difference that you want to make as an organization, to be able to kind of rally all the stakeholders, whether they're internal or external, and really bring those partners together. So I think one of the other shifts we did over the last 5 years is started to move away from the teams in the organization that are doing work related to environmental sustainability, and instead create a strategic roadmap and a strategy around the key areas of action that we all want to drive. And really Cascades, another pan-Canadian network, really driving focus and playbooks around environmental sustainability and healthcare, really helped us in looking at, how are we going to frame the planetary health strategy? And we really identified 5 key areas of action. One is around facilities and infrastructure, something we have been working on and focusing on for well over a decade. Focusing on adaptation and community support and engagement in extreme weather events, another one we've been working on for many years. But really new to the strategy is a focus around clinical service delivery. How do we deliver care differently to really provide high quality, low carbon care? Food and nutrition as an area of action, as we really start to really better understand the huge carbon footprint that food creates. And also start to look at supply chain and business practices. So once we identify those 5 areas, it elevates food and nutrition. It makes it a quality agenda now. So now that completely changes it from a support service, which is some of the way that people have thought about food services in the past, to actually a fundamental, integral part of providing high quality care to our patients, more nutrition, faster recovery times, less waste, reduced carbon footprint, and that kind of elevates and changes the whole discussion in the organization. It also brings in the excitement of partners that want to help to fund it. So I think it's really, when you talk about that triple word score, I always think about this really is a win-win-win, right? Better for the planet, better for our patients, reduce waste. I know for me, I have extra passion and energy around it, probably because I actually started out in food services. That was my first entry point into healthcare. I worked in the food services department on the tray line in the dish room for 7 years, and I firsthand saw the amount of waste that came back into that dish room. And so it really is a big shift for us to see food differently, and a great opportunity to think of, that people and planet intersection. So it's been very exciting for us from a strategic perspective.
Yeah. Do you think that time in the dish room working on food, was that critical in developing this executive level leadership? Will other executives get to that place of recognition around the power of food without spending their time in the basement of the hospital with their hands in the food and in the dish pit?
Absolutely. Absolutely. I think for me, that's just a personal connection I have. I mean, I think I hope I bring as much, passion and energy in advancing the other parts of our planetary health agenda too. We're looking at the regional anesthesia. That's a huge one we're doing as well. I think I bring the same commitment and visibility and really lift that up for these strategic discussions. So no, I don't think in any way that my experience in food services is required for us to have been successful in this in any way. But I think it gives me even just more a kind of excitement and energy around, I saw that difference 30 years ago. I could really understand the need for it. It wasn't a discussion we had at that time. But I think it's about connecting it to strategy. I think it's about connecting it to quality. It's about shifting people's perspectives where they're not saying that we're making a choice between patient care or the environment. To me, that's actually the crux of it all. There actually is doing the right thing for both. And this is a great example of where that is just, very evident by everything that we can showcase today.
Okay, well, before I let you go, I just want to ask another question about, having just being a VP of Planetary Health. Can you talk to us a little bit about how that portfolio emerged? Are there examples that you look to elsewhere in Canada, other jurisdictions? Where do you find good company and inspiration to kind of support that leadership with that frame?
It's an interesting question. I haven't actually seen it set up in the same way in other healthcare organizations. I feel that the focus around planetary health and some organizations are more specific or still around more the environmental sustainability focus. It's a little bit more disconnected from the quality and clinical side in some organizations. So I don't think I've seen somewhere that's doing it in the same way as us. And I think the way we've done it is quite interesting because we have many VPs with accountability for elements of planetary health. When we look at our roadmap, our CFO has responsibility for supply chain, facilities, infrastructure, and all of the work that we have implementing those areas really reports up to him. We have our Chief Medical Health Officer, who is the lead for population health, climate adaptation, the community engagement, healthy people, and thinking about recognizing that all of our populations are not impacted equally by extreme weather events, and making sure we take that equity-based intersectional lens. So that's our Chief Medical Health Officer leads that work. We then are really lucky to have a regional medical director, Dr. Andrew McNeil, who's working in the quality and innovation agenda to lead some of the clinical work. Our food services team reports into our Associate VP Corporate Services. So I think what we recognize in the organization is, I am a strategist and a change leader. I do not have the background and the expertise in environmental sustainability and climate action in this space. What I do have is a very clear idea of what we want to advance as an organization. And my role is to make sure that we have the alignment, the executive support, the resources to advance this work in the organization. And that's kind of the lens that I take, and bringing together all of those experts in and outside of our organization to advance change.
So we're going to hear a little bit more from your colleagues who have been more operationally involved in this. Just last kind of parting thoughts from you. Any wisdom to impart to other jurisdictions in Canada that are thinking of taking this approach or considering kind of this planetary health strategy for their own organizations?
Yeah, I think it's, I think the core biggest piece of advice I would give is around just really being able to storytell around the quality and environmental impact coming together. Like, where do you have opportunity to do the right thing? So I think there's lots of areas where actually there's a huge investment required in order to do the right thing from an environmental sustainability perspective that we don't necessarily have money for. We're getting real big water generators and all sorts of other things. Pick the things that are the win-win. Like, start off, the food is a great example, but pick the things where your story is this better for patients, it's better for the system, it's better for the environment. Pick those ones, and it starts to build and elevate some of the work. And that's where food is a great example. And it is such a shift out of that support service lens to that patient care lens. So I think there's a ton to learn from our team. They've done an absolutely unbelievable job. And you'll see from who's going to talk throughout this webinar, like how complex it is and how many different perspectives are coming together to have really been able to be successful in this group. So I hope a ton of people can learn from this. I'm excited to hear our team share the rest of the work.
Okay, so taking food from the support services lens to more of the patient care lens. So many great insights in there, Darcia. Thank you so much for your leadership on this. And now we'll turn to bringing in your colleagues, Tiffany, Liana, Chef Ned Bell, and Amy, who are part of the team who led at the operational considerations and applying culinary creativity to get this project going and off the ground. So welcome to you all. There we go. Hello.
Good morning.
Morning.
Thank you for having us.
Yeah, okay. What a pleasure. Okay, so Tiffany, let's start with you. How about just as we start to get into some of the details, why don't you kind of give us the overview a little bit of the project itself?
So the project is a really exciting one, of course, and I think it's well, in the project, we initially developed 54 recipes from entrees, sides, soups, desserts that we were able to test out in a small scale. As Darcia mentioned, we were able to kind of bring together all these different stakeholders and rally around this project and the vision and mission of it, and to do something that is the right thing to do, that makes sense for our patients, from quality, but also for the planet as well. So during this time, we worked with Chef Ned Bell to develop these recipes. We tried to understand the operations and how to tie in the challenges of what we're trying to accomplish to making it work in our system, engaging the different stakeholders along the way, including the dietitians, hospital staff, visitors, and patients, and then serve it to see the results of that.
And so can you talk to us a little bit about, and maybe Liana jump in when appropriate, but the considerations for applying this kind of project to a working kitchen?
So,
Oh, go ahead, Tiffany.
Go ahead, Liana.
Yeah, so definitely, as kind of the project manager, but also having a foot in the food service operation, just having been part of the on-site team for several years prior, I'd kind of helped the team just better understand the food service operation. And like you said, it's a working kitchen, it's an old kitchen, and we have kind of existing equipment and workflows to consider. So, the food service operators on this call would certainly understand or relate to that we are limited in what our equipment can do. We are limited to how much storage space we have on site. And in our operation, what looks like a simple menu change could really just push our fridge past capacity. So, having learned this, there was just a lot of creativity, especially from Chef Ned, put into the menu development stage to accommodate for some of these challenges. And I think certainly another one with that our existing workflows for our unionized frontline staff, these are fairly fixed. And so menu development needed to consider any production labor involved. Our hospital runs 2 tray lines or assembly lines that were already at max capacity, essentially. So we needed to strategize how to build in a little extra work to help elevate a dish. And so one example was, looking at a garnish that would typically be executed at the last step when the plate is assembled, but doing that for 500 individual trays just wasn't feasible. So instead the team kind of found a solution to have the garnish done for the entire food pan just before it was placed on the assembly line for portioning. So that way, when the dish is plated, the garnish still sits on top. And these are just sort of some of those considerations that we thought about for our food service operation.
And so, okay, so, not all hospitals still have working functional kitchens. Just take us into the belly of your beast. What was the trickiest thing to work with? Or was there something that needed to be acquired or replaced or creatively redeployed?
I wouldn't say not necessarily acquired. I think our team is so large within that kitchen. And not only do we have our regular full-time and part-timers, we also have casuals. And so I think communication was such a big part of this project. It was important to communicate often and to everyone and just sort of understand who's involved with what, who needs to be engaged, who's actually doing the work. And so an example could be just, us making a menu change. We would need to engage the diet technician who's actually making that change in the nutrition management software, to the supervisor who's going to do a tray line huddle with the team, engaging Chef Ned who would plate a dish to show the team what that should look like. And then really just talking to all the frontline staff to check in with them to see if there were any challenges that they experienced and to see what we could change afterwards.
Okay, great. Okay, Amy, let's turn to you. How was the menu developed and tested?
Yeah, and I feel like Ned can probably chime into that one too in terms of his role and coming up with all the recipes. But really from my perspective, so I'm a dietitian by background, and in my role, I really support kind of bringing everything together in our menu. So we have a lot of different priorities with our menu or different goals we're trying to achieve. So in my role, I try to listen to see what those priorities are and kind of bring it together into the menu. So at VGH and at our other sites in VCH, we have a rotational menu. So every day is a little different. Lunch and dinner, we usually have 2 different options on our menu, and then it rotates throughout the menu cycle, which at VGH is a 14-day cycle. So once the recipes were developed, like the new recipes went through several iterations until we kind of landed on the version that would work. But we really looked at where to put those on the menu where it made most sense. So targeting those, recipes that were on the menu prior that were, maybe had higher greenhouse gas emissions associated with them, and trying to find those spots on the menu and then incorporate these new recipes to replace or swap those out. But of course, we have to look at the menu overall and ensure we're maintaining variety and that we're meeting nutritional requirements for the menu. And, looking at the cultural diversity as well and making sure there's not, a little bit of everything within the menu. So yeah, a lot of different considerations in the menu and just trying to kind of bring it together and making sure that we're maintaining overall kind of what our goals are for the menu and meeting the different requirements that we have. So just a lot of review process, engaging different folks and making sure everyone's comfortable and feels that the menu meets what we're looking for out of it, and yeah, with the new items on the menu.
So you and several others have alluded to the one in the chef's whites. Chef Ned,
Good
what was
morning.
good morning. What was the biggest surprise for you coming from the restaurant world to a hospital kitchen?
Oh my God, do I only get to pick one? I mean, first of all, I felt incredibly fortunate to work with this team. I after listening to Darcia, I'd run through a wall for that lady. She's just spectacular when it comes to inspiration and just her deep commitment and passion. I came to this through Dr. Andrea McNeil, who is actually my wife's surgeon. So I came to it, from an honest point of view, and then obviously got to work with Dr. Annie Lalande, who's now an incredible friend and peer, and we work continually on all of these recipes with Leanna and Tiffany and Amy, Elaine, and of course, top to bottom, the teams at VCH, the culinary or the food services team, the tray line team. I mean, the recipes, I don't even know if they'll ever be, completely finished because we're constantly trying to perfect them for different sites, different equipment, different skill sets. The one thing that I think is quite important is that we talk about purchasing. We really tried to work within the current structure of purchasing. We were using ingredients that were available to us. We have a few very specific ingredients that we were able to get, brought on board by our broadline distributor. But for the most part, we're working with available ingredients and available skill set. I mean, my job was to make it delicious, which is simple enough, but it's so much more complex than that. We had to, I was very fortunate. I had the food service lead in the kitchen, Henry's son, who, worked just as hard as I did with his team on these recipes. Without him, we wouldn't have been successful, or I wouldn't have been. I mean, there have been many challenges, but as Annie could probably allude to, there's also been an incredible amount of wins. Cooking for people from 10 years old to 90 years old is very difficult. Vancouver, like many country or many, regions across this country, is very culturally diverse, as Amy alluded to. So, we try to, broad stroke have cultural diversity, which was never easy because it's very hard to be completely authentic because some cultures aren't interested in other cultures' foods. And so we've tried to really add deliciousness that foundationally was, I guess, Western, and then trying to add Korean flavors, Thai flavors, Chinese flavors, South Asian flavors, indigenous ingredients. Although that was not a clear focus at this point, but we already have indigenous ingredients all over our menu because we highlight things from this place. Very specific to, or what I would describe as our unique taste of place here in Vancouver. But of course, I really think we're going to continually working on these recipes, new recipes, seeing what works, seeing what doesn't. And we met every week for hours to talk about this project. I mean, the amount of time and resource invested in this project was significant, but incredibly necessary because I had to learn constantly. I mean, I'm not in healthcare. I'm a culinarian from outside who has now spent 18 months in healthcare on a sort of, part-time basis, I guess you could say. But my gosh, have I learned a ton. And, I was really inspired by, peers like Joshna Maharaj, who had done some incredible work in Ontario a number of years ago. And, I really feel like this project was just meant to be because I remember the meeting where we were talking about this pilot of 100 people, and Tiffany and her team was like, well, I don't know if we can do it for 100. I think we have to do it for everyone. And, in my dreams, I think that Annie and I looked at each other and were just like, let's go. Because this is exactly what we needed to actually make it work.
So we've heard a couple allusions to the importance for this food to be delicious and appealing, and we know that as there can be a lot of pushback against historically, especially plant-forward menus, especially from a meat and potatoes population. Is there? I'd love to hear a little bit how you encountered that and how you addressed it. But specifically, I want to start with: is there a dish that you're all most proud of that came out of your collaborations? I think you said, Tiffany, you started off with 50 plus different menu items were developed. Is there, what stands out? And Tiffany, let's start with you, and others chime in.
Yeah, there was so many delicious dishes there, and as Ned had created so many, but we had to whittle it down in the last phase of the project to when we were ready to share it out with the patients. We whittled it down to 20 that we want to focus on. Out of those 20, I would say I personally love the Korean gochujang bowl. It was like, it just speaks to the cultural diversity of our patients. It is a plant-based dish, so it's very unique. Had a very addicting sauce that all of us, I think, would agree to. I would just be looking to Ned, like, giving me a bottle of this sauce, please. And I would add it to everything else on my plate. So that was my favorite. And I think just transforming hospital food just through culinary side, we're so thankful to have Ned on board with us just to rethink nutrition, taste, and presentation, just to create those meals that everyone to enjoy, right? Like, it's just, so food doesn't have to be overly complicated and fancy, as Ned mentioned, like, but just to make tasty, nutritious food that appeals to our patients, residents, so that they enjoy what they're eating and they're actually eating it. And so that's where just simplifying where, details like presentation matters, making the meals visually appealing can significantly just enhance that patient's dining experience. Plating and using vibrant ingredients makes a huge difference, since people really do eat with their eyes first. So I think just also focusing on incorporate the cultural and global flavors keeps things exciting and inclusive. And when we're sick, we just crave those familiar flavors that are reminiscent to comfort and care. And then equally important is the training of our food service staff. I think Ned can contest that. It's just so important to work with our staff. We have so many different sites with so many different food service workers, that how do we ensure that they're executing and have the skills to prepare and present those food properly in the way that we envisioned it, so that it translates to the lived experience of our patients, that they're seeing something that is exactly what it should be. And I think just when we have those chefs and dietitians collaborate, we just create those meals that are both delicious and supportive of their recovery. So think nutrient packed and balanced options that truly impact health. What's nice is that I'll mention our Ministry of Health just recently released new nutrition standards that were in development with our health authorities. And what's exciting about these new standards is that it poses a North Star for all of us to encourage us to start to liberalize diets and remove overly prescriptive diets that may at times be a barrier for patients, and start to shift towards new food service models that support patients' choice at mealtime. And so not only are we creating delicious food, but we're also putting it on our patients to exercise their choice to choose what they feel like eating, what makes sense for their time, and what for their comfort. So ultimately, I think it's just about making possible food a positive part of the healing process. Good food can lift spirits, speed recovery, and create that warm, welcoming environment in the hospital.
Amazing. Okay, so today we're not eating with our eyes first so much as eating with our ears, but we'll have to put some images of these dishes up on our social media. Ned, Amy, Leanna, do you want to chime in with any of your favorite dishes? And, we've got a question from a participant too, in terms of catering to different segments of the patient population and seniors in particular. Was there anything for you that stood out for various populations that you were working with?
Yeah, absolutely. I will first start off by saying, out of Ned's 54 original dishes, I tasted them all. But with, in the 20 years so that we were implementing across the hospital. My favorite was the peanut rice noodle bowl. It was also a plant-based dish, but I've eaten hospital food for the last 10 years, so I'm very familiar with the menu options. Having a noodle dish was a new start for us. It offered that variety. It offered the color of, bok choy, and just having flavors that represent a large part of our population. So that was definitely one of my favorites. And speaking towards the different populations, in long-term care, some of them were elderly populations. Some of our other dishes, like the steelhead dishes or chicken and turkey dishes, did quite well. And we are nudging patients toward sustainability and planetary health. It doesn't necessarily just mean going plant-based. We wanted to start off with smaller, more subtle changes. So really the strategy behind replacing some of our beef dishes or red meat dishes with some of those lower emissions options like steelhead and like chicken. Those, we found success with that.
So meat is still on the menu, but not a center plate item. Is that right?
That's right.
Yeah, I mean, we looked at the 2-week rotation of our menus, and we looked at the average stay of a patient being, let's say 7 days for argument's sake. So over the course of their stay, we tried to give them, diversity throughout, animal protein to a certain degree, and plant forward dishes to a certain degree as well. So sort of giving them variety throughout their I'll say eating journey. I spent the last 15 years in sustainable seafood, and so I would say the dishes I almost knew would work are the 2 seafood dishes that we launched. And we really tried to regionalize the fish, but also have fish on the menu that actually A, was affordable, B, was available, and C, we could cook really well and lived long enough in the hot box to get to the patient properly. Because truthfully, it's great if it's delicious in the kitchen, but if it isn't delicious on the hospital tray in front of the patient, then there's no wins there. The Korean gochujang bowl that Tiffany mentioned, that has a couple of plant-based proteins in it that we worked with a local supplier to provide us with. It's called it doesn't matter what they're called, but it's a spectacular company owned by a mom and a daughter that has been in business for the last 15 years. And so really trying to look within our region as to what was available to us from not so much a seasonality point of view, but from a local regional business point of view. It was not an easy project. I mean, let's be fair. Like, what I really looked at was like, what are the things that we already do that we can tweak 20% that will make the dish better? And by better, I mean more delicious. So, obviously we looked at our vegetables, fresh and frozen. We looked at our proteins, animal and plant-based. We looked at our starches. Can we cook our starches, quote unquote better? Our sauces previously were, often pre-made, often a little bit cloying. And so, could we make some dressings and vinaigrettes and sauces that were bright and bold and culturally diverse, that sort of added, freshness at the end of an operation? It wasn't about like scrapping what we were already doing. It was about sort of 20% improvement across the board. And that made it really easy. And those were the dishes that ended up being of the almost 2 dozen that we chose. Some of the 54 were like really blue sky, and we may revisit those at some point. But I think the, like, I don't know, could we make our own fruit preserves? And we were looking at packaging and obviously food waste and all of the different packaging that comes into the kitchen. We were looking at could we make our own fruit preserves instead of buying jam, that kind of stuff, or maybe not make them but have someone make them for us. So
Right. Yeah.
like little things that could make a difference.
So looking at those waste dimensions as well as the plant forward dimensions, when you're looking at that kind of overall climate dimension of reducing greenhouse gases. Okay, I've got to move along here, but just lightning around. I want to put it to each of you just in a couple of words, really. What you found was really critical to the success of the project. So we've talked about the importance of kind of a diet liberalization and focusing on knowing, recognizing, you know, foods are only healthy and nutritious if patients want to eat them. So it's got to be delicious. We talked about things that you could cook well, things that worked within the system. We talked about kind of 20% improvement. What sourcing, focusing on things that you could source. What haven't we covered in a word or two? And Tiffany, maybe I'll start with you and just go through real fast lightning here.
I'd be really fast about it, but I do want to put a kudos to our communications team because our project team felt so strongly from the beginning that communications for internal and externally would play a significant role in our projects, because we had two big goals, really, to raise awareness and promote VCH new Planetary Health menu items as healthy choices for our patients and planet, and also to just demonstrate our commitment to providing that exceptional care experience by embedding Planetary Health principles into our organizations and how we're changing and evolving everything that we do, and in this case is food services. So yeah, there's the value of communications to support our team so that our top line messages are communicated and conveyed in a very concise way. And sorry, I know I'm taking a little bit longer, but just as I reflect back, it was also beneficial that we spent some time at the beginning to scope out our target audience, to know who our primary and secondary target audiences were. And again, that just helped us fine tune our messaging so we were just clear throughout the way.
Incredibly important factors. Yeah, knowing your audience, speaking with them effectively, building those in internal comms, as we talked about as we were prepping a bit. That's great. Thanks for highlighting that. Leanna, in a few words, for you, what was critical to the success of this work?
Yeah, definitely to kind of expand on what Tiffany mentioned about the learning process. You know, we spent a lot of time, you know, collaborating with Greener by Default. They shared really helpful insights and strategies that nudge people towards, you know, plant forward menus, like the way we name something, to what kind of wording do we use to describe a dish. So, for example, using the words that describe the flavor rather than using the words vegan or vegetarian. Those are really helpful strategies. And there are many of those out there. I really encourage everyone to take that time to learn and to read all of those different resources. They are really helpful in helping to communicate a consistent message, not only to the internal teams, to our patients as well, and to the clinicians, you know, just to get everyone's buy-in.
Yeah, okay, so that's a great insight that is highlighted in Nourish's Cool Food program. Just like those behavioral insights around how you frame something is going to make a difference, right? It's not, I think I've learned this from you folks, it's not like vegetarian stew, it's like cozy Moroccans, you know, chickpeas, you know, there's a beautiful naming to it, and I'm not obviously going to pull that off on the start. Okay, I'm going to keep moving unless you really, in a word or two, Ned or Amy, you could just point to one thing that we haven't mentioned yet that you feel is critical.
Go ahead, Amy.
I was just I probably has been mentioned, but really it's just more the collaboration that I wanted to emphasize, and working as a team and just being really open to ideas and trying to think differently. So I think for us, bringing in Ned was really valuable because he brought a lot of fresh ideas to us. A lot of us have worked in food services and healthcare for a long time. So just having fresh perspectives on the team as well, and then just collaborating and hearing everybody's point of view and ideas. And I think a lot can come out of that, and just working together to move forward with something.
Yeah, chefs back in the kitchens. Are we challenging? It's like, is it revolutionary, or are we going back to the 80s, the 90s, like chefs, butchers, bakers in the kitchen? Like, we used to have people who knew, or sorry, no, we used to have these professions in the kitchens right there. Okay, Ned, last word to you before I move along to Elaine.
I mean, VCH is leading the way here with this project. They just hired a really premium executive chef, David Barshears, to lead this. When I am, maybe finished with the project, so he will carry the torch, which I think is crucially important.
Amazing. Great.
I hope
Okay.
to not be done, by the way, but hey, that's up in the air.
Yeah. Well, we know it. Okay, amazing. Well, you can't hear the virtual round of applause because everyone's muted, but round of applause to this lineup. And we're going to turn to Elaine Epler, a clinical dietitian working on the project. And Elaine, I'm just going to start off with, sometimes dietitians are thought of as the food police, but that's very much not how you approach this work. So why don't you tell us about how you do approach this work?
Absolutely not. We do, I think, have had that reputation, but it's quite the opposite. We as dietitians encourage our patients and clients to eat and to enjoy the food that they eat, particularly in an inpatient clinical setting. We know that food is not nourishing unless it's eaten. And I think I saw somebody write that comment in the chat, and it's so very true. And I've been excited about this project from day one. And especially with having Chef Ned involved in creating these amazing dishes that look delicious, and as we know, something that appeals to the eye is more likely to be consumed as well. So malnutrition is a concern in the hospital, and so it's more likely if we place a greater emphasis on the appearance, the flavor, and the nutritional qualities of our meals, it's more likely that they're going to be consumed.
Amazing. And so can you talk to us a little bit about how, kind of what shapes your thinking around planetary health, connections with human health and food? Because I know it from our conversations and from seeing you present before, Elaine, you draw inspiration from a number of sources and are quite thoughtful and methodical in how you approach this.
So I guess I could, there's a couple of places I could start. I'll just strongly endorse our Vancouver Coastal Health Planetary Health pillar, which certainly guides my practice. Also it's interesting the way I came to this Planetary Health Menu project. It was through Nourish about 3 years ago, but it was through the Food is Our Medicine course. And in fact, in preparing for this presentation this morning, I went through some of my old notes from the course. And I just realized at the time I was taking the course, I didn't know there was going to be a Planetary Health Menu pilot project. But it's just so beautiful the way everything integrates. And it's true, like from time immemorial, the Indigenous peoples all across Turtle Island have been the stewards of our land, our waters, our plants, and our animals. And we can learn so very much. We as those of us who are uninvited guests or settlers on this land can learn from this. And I do really feel that we need to draw upon these traditional Indigenous sources of knowledge as we try to tackle our various planetary health challenges, including learning from them about how they practice sustainable food systems from, as I say, time immemorial. Learned so much through that course. I have a notebook just filled with reflections. So I'll you didn't ask me to do this, but I'm going to give a little shout out to Nourish. And I know there's an upcoming Food is Our Medicine offering starting in February. So I'd encourage anybody who's part of this webinar just to perhaps consider starting there, or to complement your planetary health menu journey by taking that online. It's a learning journey.
Well, okay, Elaine, thank you for that unexpected shout out. Yes, there is a new intake of Food is Our Medicine starting in February, and so that's a nice, and we'd love to see participants join it as you did. And I'm so glad that it has been fruitful, and it's amazing because I think wherever you are in your journey or in food, folks take away so many different things from it. So it's rich in that sense. Elaine, you're bringing us to a question that is really live, and that I think globally Canada is helping to shape and frame up. So we talk a lot about protein, and we'll get to the question about kind of protein in a plant-based context. But right now, focusing on Indigenous foodways, I'm wondering how you encountered that at your facility. So we know that not all meat is created equally. Meat from an industrial food system is going to have a very different carbon footprint than a caribou herd that is moving across the land and hunted in a traditional way. So how do you grapple with this, like the messaging around cool food and climate and plant forward, and the role of animal protein in Indigenous foodways? Like how personally do you relate to it?
Well, I think you highlighted the differences very, very clearly. It's very different, the carbon footprint or the environmental costs, not just the carbon footprint, but all the costs, the land, the water use. It's very different than the industrial food system or industrial versus that is obtained through hunting and trapping. Mm-hmm. So I would just answer that it's very different.
Mm-hmm. Yep. And I think that globally, the carbon calculator that we're working with in the cool food, we don't have a way to quantify this yet. And I actually think for folks who are thinking about this as they grapple with the questions at their organizations, I think that's okay for some things to exist outside of the Western calculation for the time, because there's so much nuance in that kind of systems way of thinking and relating to food systems. It's not just about kind of what's on the plate, but how we are relating to it generally.
Absolutely. And that goes back to the food is our medicine course as well, because you do learn that the whole concept of the two-eyed seeing through looking at things through the Western lens and also through the Indigenous lens as well. So both the systems approach, as you meant, and just all the nuance. It's very challenging. There are no quick, easy answers, but it's worth working through those questions and reflecting. And I think that's something else that's part of this learning journey with the Planetary Health Menu. It's truly a learning journey. And I'm still constantly learning. And it's hard to give quick answers to these questions, but we still have to try to answer them and maybe give incomplete answers, and they'll just lead us closer to a more complete answer.
Yeah. And so, that humility, I think too, is, comes in, you're referencing Micmac elder Albert Marshall's teaching of two-eyed seeing, that the Western and Indigenous lens. Elaine, I do want to switch to that protein question, change gears a little bit. So because Nourish gets this question a lot, so how can plant forward menus deliver on nutrition and climate goals?
So the apps, so with the related specifically to protein, thinking about the protein?
Yes.
Sure. So what I did also in preparing for today, I have some links that I can drop into the chat in a few minutes. And I mainly went to dietetic associations, but the short answer is that plant-based foods do contain protein. They're found in legumes, lentils, seeds, nuts, vegetables, whole grains. They're in a variety of foods. So you do actually, and it says right, Dietitians of Canada will, on one of the resources that I will send out, states that you can meet your protein needs on a plant-based diet or plant-rich diet. So it is possible. Yeah, there's I think there's pretty wide agreement that it is possible. It may take a little bit more thought and planning, but it's definitely achievable.
Elaine, when we've spoken before, you've spoken about how we need to start thinking more about how the food is being produced. Can you talk to us about that a little?
In terms of our food systems are very complex. So where do we start with the production? Like we have to think about the soil, all the inputs. So the soil, the water, the amount of land that we use, starting at that level. I'm not quite sure
Yeah, I mean,
where to start with that, because right back to the beginning.
well, I think that's just it. It's when I think we can think about food as a commodity in a really sort of like disembodied way. It comes off of a truck from the, with the partner that you're used to working and you have a long-term contract with, but it can be this disembodied thing. And so I think when I've heard you speak about it before a little bit, it's like that food systems lens that you're alluding to now, like thinking about soil health and how things are.
And seeds as well, just starting with the seed, the soil, the water, all the inputs that go in to tend that crop, the labor, the distribution. Like there's just so many stages across the whole food system that we do need to start thinking about. And I will admit, as a dietitian, a clinical dietitian, I didn't always have that broad focus. I've been pretty narrow. And it's important is actually to have a narrow focus, particularly in acute care where needs are very specific when you're dealing with complex medical conditions. But also I think it's important to have that broader perspective and go back to the source of the food. Where did it originally come from?
Right. Okay. So just to wrap, kind of in a few words, as you think to the future of food and healthcare and your profession, where would you like to see? Yeah, where would you like to see this go? And maybe what would you say to other dietitians who are perhaps also had a narrower view and are maybe looking and listening today and thinking, okay, there's something here?
I think it's just having that philosophy or ethos or whatever you want to call it, of having an orientation to planetary health and planetary health care in addition to nutritional care. It's synergistic and complementary. And by thinking about, because truly we can't have human health without planetary health. So we need to think about how are we caring for the planet that ultimately cares for us.
Amazing. Okay, thank you, Elaine. And another big round of applause, and we're going to bring back Annie, Dr. Lalande, for some of the results. So we've had a kind of tour de force of your team. So can you take us through what were some of the results of this work?
Sure. And maybe just to start with, like, huge congratulations. This is to the entire team that's here and everyone who isn't, but has been part of this endeavor. And I hope that we've, for one, showcased like how many people do need to be involved, because like this is food touches a lot of people in the hospital. And we've brought on like a number of collaborators, but there's aspects that we haven't talked about. Like we tested these dishes in like texture modified versions with pureed and mince, because a lot of our patients do need texture modifications. And I think that was an important dimension of the work. So we brought our speech language pathologist as well to make sure that like the recipes could be served to as wide of an audience as possible. So yeah, we're really excited to have these out and published into the world, but I can tell you about some of the work.
Yeah, we know you're still crunching some of the data. So yeah, what you can tell us now, and we're gonna keep
absolutely crunching. So a couple of things. First of all, like these new dishes, as we said, were served to a majority of patients across the hospital. We integrated in the end, like 19 new dishes in the menu, where we strategically substituted dishes that had a higher environmental impact for some that had a lower environmental impact. And we really made a lot of efforts, and a lot in collaboration with Amy and Ned, to tweak the recipes and make sure that they would meet the nutritional requirements of as many of our patients as possible. And so they were like widely served, and our menu was nutritionally equivalent to what our menu was before. So we had similar quantities of proteins, carbs, macro and micronutrients. We actually had a little bit more iron and fiber, which was wonderful to see.
Okay, amazing.
In the plant rich. So like we still had a decent amount of animal proteins on the menu, but it's certainly really wonderful to see that we were able to make these switches, but maintain nutritional adequacy, which obviously was one of the leading dimensions of this work. I think one of the really fun and potentially like really impactful aspects of this work is because there tends to be a little bit more perceived, at least, resistance to plant-based options. It makes it almost mandatory for us to bring that culinary perspective, because we know that these dishes have to be delicious. We want to make them as appealing as possible for our patients. And so that menu transformation like both brings items that are more sustainable, but it kind of mandates bringing that culinary perspective to make sure that they're like as tasty as possible, and that becomes the front focus. So I think that's really a wonderful opportunity, and we've seen that generally speaking in terms of the patient experience. So overall, like we had most of our patients were really happy with these choices. We're like, found the new dishes to be tasty. We've had some patients, we've had one in particular who was recovering from surgery who told us they forgot they were in pain for a while because the food was really delicious.
They forgot they were in pain for a while because the food was delicious.
And I mean that one really moves me, like part of it from my training, but also it's such a beautiful example of like the true potential of food in a health institution. And you were talking about this, like moving from a commodity to seeing like the full potential of food being actualized. I think that's what these are snippets of what we're starting to see. So in terms of other things, we've seen decreases in waste when we introduce these new dishes. Like consistently, there's still variability in our menu, but we've seen decreases. And I haven't mentioned this, but for the dishes that we introduced, we significantly increased the quantity of plant-based proteins that we had on the menu. So if we look at what patients would be getting by default, if they weren't making a choice, previously there would be no plant-based proteins between lunch and dinner. And with the changes we've made,
there would be no plant-based protein until this shift.
No.
Okay.
So now, there were some, but as a second choice, you would have to select them, or you would get them if the first option wasn't suitable for you. So now, like with this menu project, we were up to 40% of them being plant-based. So we wanted to maintain choice. We know that choice is important for patients, and not everyone is like ready to necessarily make that shift, or ready to try. And we did have some patients who really didn't want to try like anything that was plant-based, and we need to make sure that we provide options for those patients who aren't necessarily ready to make that shift just yet, because we need to make sure that they are nourished and that they can recover from the illness or injury that brought them into the hospital. But we've certainly nudged a number of patients who were pleasantly surprised to find out that plant-based tofu dishes, for instance, could be really delicious when it's made in a way that, brings a culinary spin to it.
Well, that's one of the things I think, that your work really highlights. It's not about reducing choice, it's about expanding options and, how we sort of like edit the choices and the decision hierarchy for patients. And I loved that when I heard you first share that about kind of like patients do love tofu. I think I remember you saying, and there is like a culinary dimension to it about how we're presenting it. Okay, so Annie, can you take us into a little bit, what about the greenhouse gas impact? Are we there?
Yeah, absolutely. Well, if you can bring the next slide up. So this is the only graph in the presentation, so bear with me. It's not published data yet, but I just want to give you a bit of a high-level view of what we've done. So if you can bring the slide before, yes, perfect. So what you see here is a heat map basically looking at the greenhouse gas emissions intensity of a portion of like the protein component, which is where we've made our switch for each of the dishes. So you see the first choice and the second choice on the first and second lines. So there's lunch at the top, dinner at the bottom, and then there's our 14-day menu rotation. So the darker the color, the more greenhouse gas emissions you see in the menu. And as you can see, there's some hotspots in our menu with some of the dishes, predominantly beef-based dishes. So these are the ones that we strategically substituted at first to have the maximal impact. So our menu before looked like this, and if you want to switch to the next slide, this is what our menu looked like afterwards in terms of greenhouse gas emissions from the proteins. So a really significant shift. And overall, when we look at our purchasing for that time, our numbers that were done in collaboration with Greener by Default, one of our other partner organizations, show that we had a 42% decrease in greenhouse gas emissions from purchasing, really from switching our animal-based proteins to plant-based proteins. and there'll be similarly impactful decreases in terms of land use. So it's really great to see that, like, with these shifts, we haven't needed to redo the entire menu. I think, as Ned has highlighted, there's certainly a number of like tweaks and improvements that we've sought to do across the board. But even with these small changes, well, not small, but even with these changes, without doing a complete menu revamp, we've already had a really great impact. So it's encouraging to see that we can like start making these changes strategically and start having an impact right away.
And can you speak to what's the state of the research around kind of impacts to patient recovery times, length of hospital stay when we're working with plant-rich diets?
Yeah, that's a great question. So unfortunately, there's not very much yet. It's certainly a space where we hope that there will be more data as more hospitals start to take this on. Lengths of stay, adverse events, there's a lot of factors that play into this. So completely untangling like what the impact of switching to a more plant-rich diet, like when these changes happen at a larger scale, won't be straightforward, but we can certainly start seeing some associations, hopefully. But as we've hopefully made clear, like this association between like having this culinary spin can help hopefully entice patients to eat a little bit more. We're certainly seeing some degree of signals of that in the slight decreases in waste that we've seen in our patient comments. Some patients saying like, I didn't think I was hungry, and actually look at that, I ate my entire plate because it was really good and I just got carried away. And that's going to play a big role in malnutrition, whether it is, or that will contribute to improving malnutrition. What the impact will be at a global scale, we'll have to see. But hopefully as our patients eat more, they recover better. And it starts to impact as well, like how they're doing what they eat outside the hospital.
Well, we've heard you and members of your team say that you know, some patients are asking for these recipes, like it is shaping how they're eating when they go. Clearly, like bringing this culinary dimension to the work is clearly impacting kind of like patients' enjoyment and consumption of the food. And with that lens, you know, maybe some of this data and this evidence for the work, as more hospitals come on and see the immediate value and kind of on these indicators is there to drive the shift, we'll be able to build out that evidence base a little bit further. Annie, this work is really incredible. Just as we wrap up, I just want to ask you, like, what are you most proud of? And what do you see next? Where do you want to see this go? Whether it's in Vancouver, nationally, like where are you setting? What are you anchoring to in terms of what really you're proud of and where you want to see this going?
I am so proud of the whole team and everyone who's been collaborating and contributing to this. Like it's taken, as everyone has highlighted, like a leap of faith, a lot of time, a lot of energy and dedication. I think we've all found it stressful at times because it was on a bit of a crunch timeline, but also really rewarding. It's impacted our staff. It's impacted people like that are in the kitchen. One of my proudest personal moments is when I ran into one of the cooks who was handling carrying a big batch of our new coconut chickpea curry, and was just so excited to tell me like how proud he was of that new dish and how excited he was to have made it. I think that's really beautiful, like how that shapes everyone who touches the project. So I'm really proud and really thankful for everyone's like rallying around this project and this kind of general mission. And it gives me a lot of hope for this scaling up across the country. And I hope that it helps to elevate the role that food plays in healthcare from something that is seen as a service that we target budgetary cuts at, and we like the impacts of it are completely disconnected, to really seeing food as a form of medicine, as a therapeutic intervention, as something that demands attention, resources, and that has a lot of benefits for our patients, for our staff, for everyone who like touches and sees the food, and from our communities and our planet at large. I think it's a really powerful lever, and I'm excited to see this scale out.
Amazing. Well, we'll leave it on that note. Kind of again, you're echoing some things Darcia was saying too. It's that role of food is not only kind of in an ancillary frame, but an important therapeutic intervention, important part of patient care, really connecting us back up to this planetary well-being and the interconnected well-being that is kind of the foundation for all well-being and flourishing on this planet. So big hats off to the team at Vancouver Coastal Health, and thank you. And I'm going to pass it back to my colleague Amy.
Wow, I loved every second of that. Big thanks to everyone who presented, and thank you so much, Haley, for moderating that incredible discussion. I am going to just navigate really quickly to the slide that gives you a code to go to a poll. We're very eager to get some feedback from you. And so before I say anything further, I want to bring this slide up so you can take a moment, grab a second browser or a phone that's nearby, a tablet, and just head to slido.com and put this code in so we can get a little bit of input from you. While you're taking a moment to navigate there, I just want to share that our whole team is very energized about what happened here and also around spurring on other innovation. And so one of the ways that we enable that is through a Planetary Health Menus community of practice. Vancouver General Hospital is one of our members. We have now over 30, and we meet every 2 months on different thematic topics like reducing food waste and building culturally mindful menus. And we would welcome your organization to be part of that movement and have access to all the different resources and peer learning that we share together.
So Amy, we're just getting a message that there's no active polls. So should we just refresh?
If I click over to this next slide, do you see something now?
Yes, now it's live on my device now.
Oh, I'm happy. So with the precious time we have before we have to wrap up, I'm just curious to find out from this big group that we have on the call, where are you at in your Planetary Health Menus journey? For some, you may have started and it's going really well. For others, started, but you're having some barriers. And maybe for others, you haven't been able to see how this would work in your context. So I want to leave this up for a minute. Maybe Nairi, you might have to scroll down to see any of the other options, because I'm seeing, maybe not. So a lot of people who are going strong. That's good to see.
Amy, what can folks do to join the Nourish community of practice around this?
The easiest way to join us would be to send an email. So Nairi can put that in the chat, info@nourishleadership.ca. We would love to connect with you about how our programming could fit your needs, understand what the next step would be for you. And actually that brings us to another question. So if you think about, achieving the fullest vision of Planetary Health Menus at your organization, a magic wand and everything you wanted would happen, what is that one roadblock that you might be experiencing right now? And we have some examples up on the screen, things that we've actually addressed today in the conversation. Are we worried about the budget? Are we worried that maybe your senior leader just wouldn't see it as a priority? We're curious to get a sense of what might be stalling some of this innovation. And time is certainly a factor in healthcare, completely understandable. With any of these reasons, there can be really great ways to address them. So we think about money always coming up in the conversation with Planetary Health. We know that reducing food waste and moving to more plant-rich diets are big ways to address that budgetary concern. And we're eager to find a path for anyone. The final question is a little bit of a gift to you. We are wondering, what thing would you need to make this happen? We've got a few examples, and I have a final option, which is other. I will email my idea to Nourish. So that's a promise. If you click other, you have to send us an email. But what here would you love to see happen? Is it recipe sharing? Is it a quick start guide? These are things that we might connect in with the Vancouver Coastal Health team to really be co-creating. Just voluntold you guys that that's going to happen. We've thought often about a briefing note. Is this a project that you want to bring to your leader, but you're not sure how you could justify it? So just some options here. It looks like recipes. It's because we have Ned on the call, isn't it? Everyone wants Ned's recipes. I can relate to that. And I have an all of the above. That's really good in the chat. I want to leave this one up just a little bit longer because this is really important for understanding what we could do next. Sample recipes, menu plans, quick start guide, or checklist. If you're still voting, I'll just take this time too to promote that. We talked about Cascades earlier, and there is a playbook about food infrastructure for planetary health. Nourish was one of the contributors to that, and it's not so much a quick start guide. It's a slow start guide, but it's a good resource for sure to check out. On this slide, we have the handles of some of our socials. We've got our website, which has newly been updated. And just a note that we do send out a newsletter. I believe we sent one out like this week, but it's always coming out. So thank you so much for joining today. We'd love to connect with any of you who are ready to take on this work. And a huge, huge thank you and congratulations to Vancouver Coastal Health. We're all in this movement together toward planetary health. So really appreciate you joining today.
Thank you.
Thanks, everyone.
Thank you so much for joining, everyone.
Yeah, thank you so much for coming, everyone. It's wonderful to have this space to share about the work and see food take a bigger place across the country. Thanks for bringing us together as well.